But when it comes to our healthcare, making our own decisions is a must. We can decide what doctors we see and what our treatment plan looks like. So what happens when you are unable to communicate your wishes? That's where advanced care planning comes in. From Licking Memorial Health Systems, I'd like to welcome CEO Rob Montagnes and Dr. Eric Pacht to the show. Thanks for being here.
Good morning. It's great to be here.
All right, Rob, so this happens. An individual needs maybe immediate surgery. They need hospital care. They've got to make a lot of decisions very quickly. So what services does Licking Memorial Hospital offer in regards to helping them do that?
Sure. We've been on here before talking about making advanced directives and filling out the paperwork, and certainly that's sort of the perfunctory basic thing you need to do. I think what we've added, and with bringing Dr. Pacht on and really advancing the program with this advanced care planning, is having those discussions and making those decisions far in advance of any critical times. So you're not consumed with emotions, differing opinions, differing family members with differing opinions, but really trying to set that outlook, have an understanding of the values and the fundamental way you want to handle those end-of-life situations, but far sooner than when you're in the hospital having surgery or in our ICU.
And I imagine you probably run into a lot of families that only wished they had done these things earlier.
Absolutely, and I think when you see, you have maybe sometimes local family, sons, daughters, and then perhaps others maybe fly in from other parts of the country and maybe haven't been included in some of those conversations. The time to have those conversations with the rest of the family is not, up in the ICU or out in the surgery waiting area, but hopefully far in advance in your home in a much more appropriate setting.
Yeah, definitely. Okay, so Dr. Pacht, what is your role now then within advanced care planning?
Well, first I would like to recognize and thank Rob and Licking Memorial for establishing and funding this type of program, which you will not see in most hospital systems around the country. Initially, my role was to get it started, which we've accomplished that. At this point, it's really all about education. I'll be going into the community, nursing homes, churches, senior centers to talk about advanced care planning and advanced directives. In addition, I will meet privately with patients and their families to address their concerns, answer questions, and help them understand advanced care planning and advanced directives.
And what are some of those decisions they need to make?
I think the two most important are, first, they need to decide and start thinking about what they would do and what type of care they would want if they were seriously ill and the health started to deteriorate. In addition, they really need to name a trusted and reliable loved one to make those decisions for them in case they were incapacitated by illness. And they need to tell that person, what they would want.
Right.
And they also need to start early and constantly review those decisions, as they certainly may change over time.
Now, is a living will kind of included in all this planning, or is that something separate?
A living will is one of the advanced directives that we'll definitely discuss. It is.
Okay. And so advanced planning, the one thing I think that we need to mention, it isn't really about just old age. I feel like a lot of people think, well, I don't need to worry about this until I'm in my 70s, 80s. This is something that can happen to anybody if they're in a situation, right, where they're in the hospital.
That's correct. Advanced care planning is appropriate for any individual, irrespective of age, and it's also very appropriate for healthy individuals.
So, Rob, how can a community member schedule an appointment, maybe for themselves, maybe for a loved one? How do you go about kind of getting that conversation started?
Sure. Once again, Dr. Pacht is making himself available. I believe we're going to put a phone number up on the screen.
Yep.
Folks can call that number to schedule appointments and times, certainly through our website. So fortunately, being a local community hospital, I think most of our residents know how to get in touch with us any number of ways, and we will get them hooked up with Dr. Pacht or whoever they need to speak to.
And make it a little easier. I think having kind of a liaison, somebody to sit down with, that's probably the hope, Rob, is to make it more comfortable for people.
Absolutely. Put a face with what we're trying to accomplish, make them feel comfortable, and once again, a very trusted physician who has done this for many years and experienced or been with a lot of families who've experienced these types of difficult situations. So drawing on his talents certainly should help them.
All right, Dr. Pacht, thank you for what you're doing. And Rob, as always, thanks for being with us.
Good to be here.